The South Australian government has announced it will not be adopting the national standard that a person would need to spend 4 hours with a positive COVID case to be deemed a close contact. The Premier says his state can still enforce stricter isolation rules than other parts of the country.
In the third backflip in under a week, the South Australian government has again changed its definition of who is a close contact of a positive COVID case. In SA, a person needs to have at least 15 minutes of face-to-face interaction with a COVID case where neither are wearing masks to be defined as a close contact and required to get tested and isolate for at least 7 days. The Premier says it's because the situation is different than in other parts of the country.
If you've been indoors with somebody that's been COVID positive for more than 15 minutes without a mask on, well then we are now designating you as a close contact. People are seeking clarity and now we're providing that clarity.
SA reported a new record of 2,552 cases over the last 24-hour period. 94 people are in hospital, including 5 children. The Premier expects cases in South Australia to peak by the end of January.
We still haven't got anywhere near the peak in our state. We are seeing large surges in other parts of the world, other parts of the country at the moment, and we've still got a lot to learn about Omicron.
He says hundreds of health workers are currently in isolation, and there are also 90 people in the state's prisons who have the virus. The state's opposition leader, Peter Malinauskas, has also revealed he is COVID positive, but has only mild symptoms.
Naturally, my thoughts are with everyone in the state who is now in a similar position.
The opposition leader says he'll continue to work while isolating and that his family have tested negative so far.